Hi everyone, my name is Maria Smith. I'm a paramedic for Gaston County EMS. I'm taking a class for methodology, and today I'm going to teach you guys about hemorrhage control. So, some objectives today. So today I'm going to teach you a little bit of pathophysiology about blood. I teach you how to identify and how to stop bleeding, and I'm going to also teach you about the equipment that's available to stop bleeding. Okay, so basic definition, hemorrhage is defined as the escape of blood from the body. Hemorrhage is just a fancy word for blood loss. Blood loss can be both internal and external. However, external blood loss is caused by trauma. Trauma can also cause internal bleeding. So how much blood is in the body? So approximately 7% of a person's body weight is how much blood they have. We all come in different shapes and sizes, so some have more blood than other people. Pregnant women have more blood than your average woman. An average woman has about 9 pints of blood, so when you go and you donate blood, an average woman would have about 9 bags of those in their body. The average man has about 12 pints of blood. So differentiating between arterial bleeds and venous bleeds, you have capillary bleeds, venous bleeds, and arterial bleeds. Capillary bleeds are just minor, kind of like when they check your blood sugar and you bleed there, that's more of a capillary bleed. Veins, they're deoxygenated and they flow blood back into the heart. Due to being deoxygenated, they're darker in color. So that's one of the ways that you can differentiate if it's arterial or venous. It also oozes out of the body and is usually easily stopped with direct pressure. With an artery, blood is flowing away from the heart. It's oxygenated, so it's red in color. When cut, it usually spurts, and it spurts because of how it contracts and expands when pushing blood away from the heart. It does require a lot more pressure to stop bleeding, and it is of highest priority due to how fast you can lose blood. So here's a picture, kind of just saying what I just said. So capillaries are minor. Venous ones, they're darker in color, steady flow, oozes, and then your arteries are the ones that spurt and, again, are of highest priority. So another common question is, how much blood does it take before death is imminent? So there are 4 classifications of severity. The first class is less than 15% of the body's total volume. So when you go and you donate blood, they usually take a pint. So you are right around in this category. You may feel a headache, but it's nothing severe. Class 2 is a loss of 15 to 30%, and this is where symptoms begin. Symptoms such as dizziness, nausea, feeling lightheaded, those type of symptoms. A class 3 is 30 to 40% of blood loss, and this is about 3 to 4 pints. So right around class 3, you're needing a blood transfusion. Class 4 is more than 40% of blood loss. This requires immediate aid, and it is considered hypovolemic shock at this point, and death is imminent if it's left untreated. So hypovolemic shock, it's also known as hemorrhagic shock. They're both the same thing. It's just significant blood loss or fluid loss within your body. Signs and symptoms of this are a patient can have pale, clammy skin, rapid shallow breathing, a rapid heart rate, confusion, syncopal episodes, and so on. So how do you treat shock? With trauma, you have to stop the bleeding to begin with. In the pre-hospital setting, if you're a paramedic, replace fluids by initiating IV access and administering crystalloid fluids, keeping the patient warm, and so on. If it's internal, there's very little that we can do in the pre-hospital setting for that, but replacing the fluids helps them greatly. So the equipment that's available to stop the bleeding, for minor cuts, gauze, dressings, something simple with direct pressure. For a little larger cuts, you have abdominal pads for anything here in the abdomen. They also have the QuikClot, which is this one. So this one is the one that they use in the military a lot. they use it because of its wrapping clotting factors. So we'll go over how to properly use that in a second. They have the Celox, which is just powder form that they also use in the military, that you spray on the wound, and tourniquets. So these are some of the kinds of traumatic wounds. You have abrasions, which is just carpet burn, road burn, just something there. They usually don't bleed a lot or at all. Lacerations, avulsions, which is a laceration with a flap of the skin open. Incisions, puncture wounds, and amputations. So with the gauze and dressings, before you clean anybody's wound or your own, you always want to make sure that you're wearing proper PPE, that you have your gloves, that you have your eye protection if you have it, in, just that you have your proper protective equipment. So you want to apply direct pressure to the wound with the gauze. You want to keep all of this clean as possible, and just wrap it around with the dressing, providing it that direct pressure. With abdominal pads, these are just for a little bit larger wounds, and you can also use them for eviscerations. So with the QuikClot, so these are infused with kaolin, which is just a hemostatic that's in the bandaging. The kaolin is used to speed up clotting process. So what you do is when you have the wound, you pack it with the QuikClot. You pack it until the bleeding stops. You never remove it once you've packed it. You just transport them onto the hospital. And with Celox, this is the other one that was used in the military. We also carry these here in our agency. So with the Celox, it's a syringe, but instead of having the kaolin, it has chioxin as a clotting agent. And this one contains tiny beads that expand and stick together once you've sprayed it in the wound. And it promotes clotting. So for arterial bleeds or bleeds that are really massive, the highest priority is obviously to stop the wound. So tourniquets, if somebody needs it, don't withhold it from them, give it to them, put it on them. So this is for life-threatening blood loss. It can only be used on extremities. You apply it 2 inches above the injury, and you note the time that you placed it. If the bleeding still has not stopped, you can place another one above that one and note the time that you placed it. You never remove the tourniquet. You transport them to the hospital and let the doctor know what time it was that you put these on. So now that you've learned some of that, if you guys can tell me, how would you treat this one?
Use the hemostatic gauze on that one.
You could? Okay. Another one?
Direct pressure. Direct pressure.
Pressure, I mean, it's not overly bleeding right now.
Okay. So good. What about this one?
Flap it back over. Yeah.
Flap it back over and after with some gauze.
Yep. Okay. And if you guys have ever seen the movie From Deep Blue Sea, you kind of see where this scene goes. So saying that he has now a complete amputation of that extremity, what would you use?
A tourniquet.
A tourniquet, yes. Well, okay, so to summarize, now you know a little bit of the pathophysiology of blood loss. You know the difference between blood loss coming from a capillary, a vein, or an artery. You know the about average blood that the human has in the body. You know signs and symptoms of hemorrhagic shock, and you know some of the equipment that is used to be able to prevent these bleedings or to stop the bleedings. Does anybody have any questions?
How long before you put the second tourniquet on if you need it?
If you need it, you just have to put it on top of that one. Okay, so now what we're going to do is, if you guys can go into groups of 3 and just practice putting these on, practice with the tourniquets, and I'm going to be here to help you in case you have any questions with it. So. So if you want to pass that back there.
Does that help it out?
You pop that right there in the 15.
Here, I'll just put it on this arm over.
Are you? Yes, you're doing a fabulous job.
I mean, if
Now,
need
would
to
you
make
remove this?
No, you leave it in place until
Always
you get to the
leave it in
hospital.
place.
Yes.
Thank you.
If you need to make an incision, you can make an incision.
Such a team player.
You hold pressure.
Yeah, we're holding pressure. She's holding that.
So if you do have allergies to shellfish, would you be using this?
That one is hypoallergenic, is what they say it is. So you should be
The other
fine.
stuff that we used to carry before that is what was the
So
shellfish.
both of these are
The
hypoallergenic.
sea locks doesn't contain shellfish, or does it?
It does.
It does contain shellfish still also?
Don't push it.
Yeah.
Oh,
But apparently that's not made from a, like it's a shellfish, but it's like a byproduct. Like it's not used on people.
Yeah, it's not enough to make a difference. I thought that one didn't even have shellfish in it anymore.
when I come to it, it was bandaged.
Can I see it?
That only took like 10 minutes. Didn't it?
Yeah.
You got it.
I mean, I believe it.
Yeah.
Yep.
From when I started counting,
Something else
you were
you
at
gotta do
14
with it
Yeah.
minutes.
already.
But you had
Yeah,
already
because I
started
was always
before I
told you still
started
use it
counting.
if they did have the shellfish.
It says that studies show no reaction to date.
Yeah, I'll pass it around. Do you have any questions about this? Don't ask me a question.
Those look really good on nosebleeds.
I've never.
You guys want to try this tourniquet on?
Yes, thank you.
Put on Brooke's arm, we can lock it off.
Like if you put something like a
It's not gonna count against you, you'll be leaving it in the back of the.
yeah, I would.
Either way, we have enough people. It has the click.
I'm just defective.
Slow it down, enough where you can manage it.
It's work.
That's
It's
good.
Oh, it's already in the, it's already.
They are, so you can. So I thought we got rid of the other ones because they had shellfish in them, but these do also, but it says right here, contains whatever that word is that she said, from shellfish. Allergy studies show no adverse reaction to date.
Did I step on your foot?
Oh, you're fine.
No, it says that there's not been any documented adverse reactions.
Okay.
Yep.
Has everybody seen the sea locks? Yeah. Okay. That's what called.
That little thing that you turn.
Okay, so I'm walking this and yeah, after.
What's that called, Doug?
What?
Windlass. Windlass.
Actually, I went through it a lot faster than
There
I
we go.
should have. So I still have 15 minutes left. Oh, wow.
Twisty thing.
Over it.
Turn a little twisty thing. Till it stops bleeding. Just keep turning.
Will you do me a favor? Will you go to the camera and tell me how long it's been recording?
It's not the most comfortable thing, but it doesn't overly hurt.
That's why I was looking at you.
Jesus. Does anybody have any questions? Had anything?
Everything is always too big.
14.
You pinching my hair.
What do you have to do?
Huh?
You have to do a certain amount. 30?
You're only at 14.
You're killing me.
So what do you want us to do? Practice?
I mean, you've already practiced. You can if you want to. I mean,
Why can't you?
Does the instructor count your preparation time?
mm-mm.
My injury is right here.
Right there?
We're still
Okay,
instructed
let's
back
see.
here, hold on.
You still getting this? Yeah.
And you can leave it a little bit.
There you go.
Still practice.
Say click.
Well, yeah, but
You just wouldn't be-
it twisted all my skin from this side over
Hey,
here.
we're gonna need that,
It gets
where's that
look at it
wound
when you
stuff,
turn it.
because we might have a skin tear back here.
What happened?
Yes, but the bleeding will stop.
So if you don't have an active tourniquet, can you use something?
It pinches your skin.
You can use a belt
Yeah.
or whatever you have to
All my skin is-
tighten.
That's what you want. That's what you want. Get rid of it. That's what I wanna get rid of. Yeah, put it back up here and hold my arm up.
Does it work on the neck?
No.
Hey, we can try.
Holy cow.
If you have internal bleeding, and it's a really thin person,
Oh, extremities on, she did say that, didn't she?
Yeah.
Can you
Put one
use
load
sea
and
locks
one
in
load.
the abdomen?
It's not advised,
Okay.
but I read that there was nothing against it. But
I would imagine
What?
in the military, if.
I'm assuming they use it.
You would use
yeah.
almost anything you could in the field.
Is there a reason why they don't want you using it in the abdomen?
Because it's not localized. You're trying to stop localized bleeding, right?
Yes.
Look at there, see? She taught me something.
She is.
Now, is there a certain size of wound, like
For-
abdominal, that you can't use any of those products on?
As far as the size, I'm not sure. I mean, the goal is to stop the bleeding, so I would just use it. Use what you have, yeah.
there you go home.
It does pinch.
Yeah.
It does pinch.
It does pinch, especially
Oh,
when
it's,
you
that's,
move your
and
skin
that's
around
gonna,
on the other
and that's
side
the
of your
big
arm.
thing.
You
Yes.
might be bruised.
That tickles.
People enduring the pain.
It's like that you can, these are very easy
I mean,
to
that's just
self-deploy.
like, right.
Well,
But I mean, it's just, you know,
Make sure you buy double supply, because everybody's gonna take one home
I
with
have an
them.
injury.
We'll need double.
Yeah.
I've been wounded